One thing I want you to remember when you go to meet with your radiation oncologist, which is, I assume, who you're going to meet with before you have radiation. This is your oncologist, cancer doctor, who specializes in radiology. And so they work for you. They're going to sit there and they're going to tell you, but you do have a choice in your treatment. So you can ask them, is there another protocol that you sometimes do for the same thing? Why did you choose this one over that one? You do have a choice in your own treatment. Hey, if you don't like your radiation oncologist, you can even maybe see if you can get another one. These people work for you. So please feel empowered and please advocate for yourself, because we're literally paying these people. They are making money. This is a service they provide. So you have every right to ask questions. If they get this wrong, you bear the consequences, not them. So please, please know that this is a service if you are getting. If someone's building a second story on your house, you would ask some questions, because you have a right to, because you're paying them, because you want a good quality, because you're going to be sitting under it, and this is your life at stake. So same thing with your radiation oncologist, with any oncologist, with any part of your cancer doctor experience. So I'd like you to prepare a written list of questions. You could give this to them ahead of time. I usually wouldn't, because it's going to be a long list of questions and they're probably going to answer half of them during their speech. And maybe you get in there and you realize, oh, I maybe overkilled and this wasn't important anyway. And so you probably take some out anyway. So I would have the list of questions for sure that you're going to bring, and I would make sure that they get answered. And if they can't get answered, ask if you can make another appointment, or ask if you can upload them to the portal and give them to them, because your questions are important. This is your treatment and you should know. So the first question I would ask is, what's the prescription? So I believe radiation is in RADS. And so, for example, when I had my radiation for my cancer back in 2007, they gave me the maximum amount of RADS over a 6-week period, 6 weeks period, 5 days a week for 6 weeks. And so this is important to know because, for example, I had the maximum. And so if I had the maximum here in this area, and later, let's say I have breast cancer and it's up near the top of my breast, if they want to radiate this area again, they need to make sure that they don't cross over into what was already radiated at the maximum, because it could actually cause more harm than actual help. And so if you were getting a prescription and it wasn't the maximum, then you would know that you can have radiation in that area again. And so I would just ask them what the prescription is and what the protocol is. Are they going to do it? Like, I've heard people do it for 2 weeks. When I had thyroid cancer, it was 1 day and I got a pill. And so it can be different. So ask them what the prescription is, what the dosage is, and how many days you're going to get it for how long. Another question I'd like you to ask is, what appointments are going to happen between now and when you start the radiation? When I went in for my first appointment that I thought was my radiation appointment, was not a radiation appointment. It was a CT appointment, which was fine. So then I had my CT appointment and I was like, now we're going to start. And I went to the radiation place and they fitted me for a mold. And I was like, what is happening here? And so the CT was to figure out where my body needed to be placed for the radiation. And then the mold was they were like carving out a styrofoam part to mimic where my body should be in order to get to the right places. And then they fill that thing with whatever plaster or whatever magical solution to make a lovely place for me to put my body. And then I laid down, and mine was in this like awful position, and so I'm like laying down, and all of a sudden I feel this like horrible sting, and boom, she tattooed my boob. And so that would have been nice to know what was coming. And so then I was watching her, because it looks like a little prison tattoo. She had a needle, she just went bang. And I've talked to other people and they actually had like a not rustic nurse, and they actually had like a nice little tattoo gun and just did it very lovely. So you never know what you're going to get. This is 2007 radiation. And so then they also gave me one over here to my rib cage, and I jumped. So maybe you want to ask, any tattoos coming my way? And so that mold that I had to get was so that when I got in the radiation, I'd be in the exact position. The tattoos that I got was so that they could align me exactly right every single time. And so they actually, I think, used a couple freckles. So I only needed 2 tattoos. Otherwise, I think they would have done a couple more. But thankfully, enough of the freckles and the pigmentation allowed me to avoid a couple of tattoos. So I think I had like 3 appointments before my actual radiation. Was just more of like messing with my mind, because like I was like amping myself up, like this is go time. Okay, 6 weeks from now I'll be done. Da da da. And then I get there and it's just a mold. So like that was just messed with my head. So what was the process like? So the process when I actually did go get radiation was I walked into this room with a whole bunch of people. Then they asked me to change into a gown, and then I was in a different waiting room. And then my 2 techs came. They brought me into this room and they had me lay down on this thing that had my mold on it. So then it was just a lot of like adjusting and getting me comfortable. Of course, you got to take your top off. Well, for me. So, but at this point in time, everyone at Stanford's seen my chest, so no biggie. And so they got me lined up, got me in the mold. Then they left the room, took an X-ray, came back in, did a few more adjustments, and they'll keep doing that. And they did that every single day until they got it. I mean, we got good at it, but it took a little bit to get it right. And so the tattoo and everything helps them align. And then when everything's lined up and the X-ray says we're in the right place, they leave. For me, my procedure, my radiation was 45 minutes. I've heard people say theirs was 5. I've heard people say theirs 15. So again, this is the question that you're going to ask when you're in your appointment with your radiation oncologist. How long am I going to be sitting there for? How long does this process take? Because I think mentally, I would have liked to know that this was going to be 45 minutes maybe. And so I would actually, they told me I could bring music in. And so I kind of started making playlists, and I would make these CDs, and I would, I'm sorry, I'm very old. I made CDs. You could make a playlist on Spotify and, time it out so that like, oh, okay, the music's like, not have crazy upbeat music that makes you want to dance or move, but maybe something calm, and kind of know that when this one song gets in there, you only have a little bit longer to go. So different things that can kind of help you get through. But if you know it's going to be 10 minutes versus 45, that's like a little mentally easier hurdle to jump through. So it looked like when I laid on this thing that it was like a giant KitchenAid mixer. And so I'm like laying here in this KitchenAid mixer. We're just going to go around me. I did not feel anything. It did not hurt. I did not feel burning or anything like that. But it was just, just made noise, just invisible, whatever, just, shooting poison at me. But it didn't hurt. Biggest list of questions I think should be about side effects. I think it's really important to know if the side effects are expected, dangerous, harmless. Nausea can suck, but it's not scary if you have it, right? As long as it's to a certain level and you can keep eating or something like that. So it'd be nice to have some guidelines to say, okay, these are the regular anticipated. I'm not saying you're going to have them, but this is what you could have kind of side effects. And these are the ones that if you get them, you just probably message me and let me know. And these are the ones that if you get them, just call 911, right? So kind of know where that threshold is. Now, there's could be a lot of different side effects. There could be rashes, burns. There could be constipation, diarrhea, nausea, all kinds of things. And so, fever, dry mouth, energy loss. So some of these things can be handled with diet. Maybe ask the doctor if your diet could help manage any of these symptoms or side effects. For me, he said have carbs and protein, which has never been a problem for me. And so also energy loss. I was like 2.5 weeks in, feeling great. Okay, I can handle radiation. We got this. And then like someone flipped a switch and all my energy was gone. And I just was so tired, like a different level of fatigue that I had never felt before. talked to other people, they didn't have that. And I don't know, maybe it's because I was having the maximum dosage and maybe they didn't. Maybe I was having 45 minutes and they had 15. So I don't know. Maybe I'm a wussy. Who knows? So, but for me, a couple, 2, 3 weeks in, my energy level just went away. And it took a long time to get it back. So even though it, took a few weeks to get there, I'd probably take about 8 to 10 weeks for me to get my energy back up. The burn. The first day I went in for radiation, I saw a man come out, and the first thing his loved ones did was immediately put lotion on his face, and it scared me. And so I messaged my oncologist and I asked about what I could do as far as lotion to make sure I didn't get a burn, and they gave me a couple of names of some lotions that were non-chemical based. And for me, I would rub that lotion. At the time in 2007, there were things called commercials. And so every time a commercial would come on, I would just lotion up my, radiation area. But, you can set an alarm. You can, every time you hear a certain word, maybe, I don't know, but something that kind of reminds you, okay, and just keep that skin nice and moisturized, because that burn looks so painful, and it was just, I didn't want to go through that, and I didn't. I had a little bit of redness after the maximum dose of the 6 weeks, and I think it was because I was just so afraid. I just moisturize. So that might be a question that you can ask: is a burn likely, and what can I do to avoid it, and what do you recommend over the counter? There's a lot of over the counter things that people might ask for: fever reducers, creams for rashes, constipation, diarrhea, all have over-the-counter things. Now, I'd also ask if there are prescription medications that they would give you for things like nausea or severe constipation or anything like that. And I would ask, do you feel comfortable writing a prescription for that beforehand so that I have it ready if I need it? Because the last thing you want to do is be nauseous at 2 a.m. and you can't get a hold of your radiation oncologist and you can't get a prescription. And even then, you can't even get the medication because your pharmacy is closed, even if you did have it filled. So if you have it filled and your medication is not too expensive, you can just go ahead and get it. They won't charge you unless you actually pick up the medication. And so, if it's a $10 copay, you might want to just go ahead and say, can you write me that script, and I'll have it on hand in case I need it. And I would say that for any part of your cancer journey. Anytime you're going to talk to a doctor about side effects, ask if there's anything over the counter, or if there's a prescription, you can get it written ahead of time. One of my side effects that I wasn't expecting was dry mouth, which was like, okay. And so I'm like a little bit of trouble swallowing, because I think, if you can see where my scar is, it was hitting my throat a little bit too. And so I did not find out until way late into my radiation treatment that there are mouthwashes for dry mouth. And I just found out this year that they're actually like little mints. And so now I sleep with these little mints in my mouth that just attach to my gums and are dissolved by the time I wake up, and I don't wake up like, not being able to breathe because I have dry mouth. So it's wonderful. So there are lots of things out there. You can always Google, ask whatever artificial intelligence you prefer using. Just make sure if you're going to ask for anything, just look that it's from a quality place. And if you are going to get, recommendations from Reddit and things like that, I just go by and ask your doctor if that, if there's any harm in trying that. And so, also anytime you're going to try any alternative medicine or, herbal supplement or anything like that, I would just, I don't think any chiropractic or acupuncture is going to cause any issues for your radiation, but it doesn't harm to ask your doctor about it. But I could see that maybe certain herbs that you might take or certain vitamins that you might take might have an interaction. Like for me, example, I was on blood thinners. So if I were to take anything that has vitamin K, too much spinach, or if I had too many vitamins because I was tripling up on my multivitamin, I might be putting too much vitamin K. That would actually lower the effectiveness of my blood thinner and possibly have me clot. So, that could really backfire. So these are something that I have to ask. And oh my God, I can't tell you, almost every time I have pain, a doctor tells me to take ibuprofen, and I tell them that I'm on blood thinners. And it's like, really, could you not look at my chart and and see before you tell me just to take something that I have to advocate for myself. Sorry. Ooh, I went off on a tangent. I do that sometimes. I get a little bitter about that one. Anyway, so I think that you get the idea. These are some questions that you can ask about radiation, but again, just know that you are your advocate, or have your advocate come with you, and just know that this is a service they are providing for you, and you have every right, and you have every right to ask questions, and you should ask questions because you are risking everything. This is the biggest thing that's ever happened to you. This is a Tuesday to your radiation oncologist. This is no big deal. They do it all the time. But for you, hopefully this is the one and only time you have to do this, and you don't want to find out later that you didn't ask a question that you wanted to ask. So I wish you the best of luck. Thanks.